That's you.
We good?
Yeah, go ahead and say, if you want to say, you don't have to
Okay,
say
yeah,
your name,
Brent Davidson, live here in Georgia, and I'm happy to be with Eric Bissell. I've just known him a day, and I was interested in his studies of the Hebrew, or the language, the Phoenician, basically Phoenician, the Paleo-Phoenician, the letters and what they mean, and it's interesting to me. But yesterday I was talking about things in relationship to states of consciousness and altered level of consciousness, and in my line of work I do emergency medicine, and these are some of the things that I have looked at in the past. And basically all of us are existing normal in an awake. We're awake and we are aware. We're aware of where we are. We're oriented to time, place, person, to our sensory and our perception. And then if a person could be awake and then confused, that's the second level of consciousness, or a different type, awake and confused. One of the best illustrations that are the people that suffer from Alzheimer's disease. Many of them have no idea what day it is. They don't know where they are. You can ask them about when they were born. They can remember usually when they were born, and they maybe remember their name. But when it's advanced, they may not know anything about their family or where they are. They're awake, but they're definitely confused. Just that form of dementia. Other things that can make patients confused can be like urinary tract infections. I see it all the time. Pneumonia, and I was just saying that yesterday I admitted a lady to the hospital with pneumonia. She was confused, and I put her on the antibiotics, and by this morning she was like a different person. I go, that's pretty fast, but at least she was coming the right way. People with skin infections, sepsis, any type of infection can create a confusion. You're awake but confused. Other things can do it, and we'll talk about that a little bit later now. The other thing, another form of consciousness that I look at is the dream state. You're asleep. You have a deep sleep, or stage 4 paralytic, where your body really doesn't move so that you don't hurt yourself. And then in rapid eye movement, you come up to a higher level. You have rapid eye movement, and so you have dreams, and the rapid eye movement is where you're dreaming. Other types of states of consciousness is when we talk about someone having a vision. Well, the visions from the Bible. You have the biblical visions, and some people prophetically saw visions. One of the different prophets out there. I'm familiar with the visions of Ellen G. White. Okay, and I've read many things. Very interesting.
Pretty astounding. Can I supplement?
Yeah.
A friend was just telling me about that. She didn't just imagine stuff. She apparently claimed that she was taken in some sort of state of vision to the very event of the crucifixion, saw it real time, and wrote down what she described, which is the type of thing that makes her book so astounding, because it's like an eyewitness account.
Right.
She wasn't just doing nice authorship.
Well, it's similar to what we're doing right now. We're recording, and what she saw, and she makes those statements, and I saw. Well, what did she see? She saw a recording, or she was seeing something that was recording. She took that and then wrote it down on paper. So I saw is what she said many times.
And also, from what my friend is telling me, that she was, this was before electricity, but she'd be sitting in her room and the light would be beaming, shining out from the windows and under the doors, and people in the community would say, oh, there's Ellen, I guess she's getting a download right now.
Well, what's of interest, I had the privilege of visiting where she lived last, in St. Helena, California. In the house, her great-grandson was giving a tour. It was on our church. Took a trip up from where I lived in San Jose. We went up to up to St. Helena and toured the house and looked on the second floor. We're up on the second floor, saw where she wrote in her study, and then we came into the bedroom. And he made one of the most astounding statements I had ever heard. He said that Ellen White could determine between a vision versus a dream. The way she did it, she stated that before the vision, she would see a blue haze around the base of the bed, and then the angel would show up.
And that was a vision.
That was a vision. She could see it by the haze, of the blue haze. And we were talking earlier about the electromagnetic spectrum. Well, if you look at the electromagnetic spectrum, way high energy, high frequency, way out here, as you slow that down, you then get to ultraviolet, which is blue, and then as the angel slows that frequency down, now she can then see him or whatever in the retina. The retina picks it up, because if his energy's too high, you disappear. The angel disappears. But that blue haze caught my attention. I go, okay, he's just slowing the energy down.
Huh.
And now that's how she determined it wasn't a dream. This is real. Because of that blue haze. That's what he said. And I've never heard anything like it.
Amazing.
It was, okay. So anyway, the one thing that, besides visions, another one is what is called out-of-body experiences. Out-of-body experiences are really fascinating to me because you're awake and now your perception of where you are is altered, in that many people will report that they can see themselves from the ceiling looking down. And there is a physician out there that's actually doing an ongoing study of this, where he'll put up high in the room, up on a ledge, a word or something up there to see if, when the person's expressing that out of body, that they could see that and if he'd report it.
Like what's on the shelf?
Yes.
I've heard that happening.
Yes.
That they could do that.
They be able to see that. And out-of-body experiences have been actually created. There was a lady that had seizure disorder, and they had her awake, and she was sitting in a chair, and her legs were out, and they had the cranium open, and they were probing for the seizure to find out where the seizure was at. In one part is the posterior singular gyrus. They, on the right side, they mapped. You can see this on you can go online and actually find this. And probing it, she says, I see myself going out, out, out. She's awake, and I can see my legs extended out. And she's now up here as they're putting the electrical current.
So her vision consciousness
Yes,
is now remote from her body.
That's correct. And she was having an out-of-body experience, and she was saying it in real time, right there as they were doing it.
Wow.
They would then back out, go another part of and she'd come back into her body. She would then come in. It was, okay. And they had actually done this a long time ago. This was like a repeat of a research that was done before. This is not the first time that they've been able to do it. These out-of-body experiences can be in relationship to when the brain is hypoxic. And a lot of times when we're doing patients with codes, they're hypoxic and we're trying to oxygenate them, either, directly or
Something's being aggravated
something
right there.
is making, and now they say, well, I saw myself out here, and okay. And the gentleman I was describing to you, in the back in my residency, this was back in 1983, the guy had gone, he was at Hilton Head, he had been diabetic, and he played a rheumatologist, played tennis with a rheumatologist, I feel sore, so the guy gave him 10 milligrams of prednisone. Well, by the time he got back to Dayton, Ohio, the guy was in a diabetic coma. A blood sugar of 1,200, and I had to intubate that guy, breathe for him, and then by the next morning, whatever, we got his blood sugar down. We had extubated, and then I thought everything was going to go fine. Unfortunately, the ventilator was contaminated with an organism called Serratia marcinens, and it infected his lungs, and he went downhill. And we had to re-intubate him, but we didn't know what was going on till the cultures came back, and we found out it was contaminated from the ventilator. Anyway, he was again unconscious. We had to paralyze that guy. His lungs were so stiff, and gave him morphine just to keep him comfortable. But after we got him out of this and healed, he came back, and he was describing to me actually walking in the basement of the hospital. He had traveled, although he was hooked to that ventilator the whole time on closed circuit test. He never left that room, ever. But his brain or consciousness did, somehow. Still not sure how that mechanisms of that. And so on many accounts of out-of-body experiences, many of them talk about, I see a tunnel. In fact, there's paintings of I think it's back in the 1500s, where you see this painting. It's a circular painting, and the man is the angels. They're taking him up through this tunnel. Okay, well, this phenomenon of this tunnel vision, something is happening in the brain for their perception. The perception of this out-of-body experience. The thing that is interesting is that not everybody has them. I had my first year residency, I had a 36-year-old lady came in with a heart attack, and she kept going into cardiac arrest, and I shocked her. She kept going, and the medications that we were trying everything to keep her from going in. I was shocked. Finally, I shocked her like 12 times. And then we don't have it anymore. It's a drug called beryllium. We gave her beryllium, and it worked. Okay, it worked. Fortunately, it worked. And I remember asking her, well, did you ever see anything or hear or anything during that? Nothing. Not one time.
Consciousness.
But she was oxygenated the whole time. I mean, she would, as soon as she'd go into cardiac arrest, we'd shock her right back into a normal rhythm. But then she'd go into the ventricular fibrillation, and unfortunately, she did that multiple times. But she never saw light, she never saw anything, not once. And she was near death, 12 times. Didn't see a thing.
Huh.
But she was well oxygenated the whole time. People that, I believe that when you have lack of oxygen or hypoxia to the brain, that of itself is going to start causing issues of this nature. And that gets me into the aspect of near-death experiences, of which these near-death experiences can be induced. You can use the ayahuasca plant to do it. Okay, the dimethyltyramine is the substance, and I was talking to you about how that the stuff that you see during those trips using it, there's all this imagery with fractals, repeats, and I showed you that the other day.
Online, just mind-blowing. Looks like something out of the 60s hallucinated LSD type of pictures.
That's a state of consciousness. You found that is a state of consciousness. And the thing about this, these near-death experiences, there's a website, IANDS, International something Near-Death Society.org, and you can go and look at all the stories. And it's amazing. Some people actually have very bad trips. I mean, that's not good. Not all of them are good. A lot of them, so I see the blue, this light and everything, or a good white light and whatever. Some people they just really, go, no, this was the worst thing I've ever had.
Well, so I've heard that some people have written books of compilating various stories where people actually are sucked down into hell and see the devil and flames of fire and screaming and torments, and then they are able to come back, and it's like, I don't want to go there, but the question is that a state of consciousness, or is that a vision of a removed veil where they're actually experiencing another reality? Well, a different dimension.
Well, the thing of it is, these accounts seem to be based upon what your religion or what you were taught. If you get an atheist, these near-death experiences, they don't correlate.
They don't look like heaven and hell.
That's right.
So there's a movie that Robin Williams was in, What Dreams May Come, which is about that very thing. And the people in the family that died in, I believe, it was a car crash or something, and they went to the places of their imagination.
Right.
of their ideal. And
Right.
it's like, well, who knows? That's
Right.
a quote
Yeah,
from Hamlet.
yeah. So you can, some of them, they're not all good, I'll tell you that. And some of them are some of them are bad, and they seem to be related to your belief system. And so, in looking at this in detail, all the atheists or the ones that believe in, the Eastern religion, kind of tend off to that. That's what their near-death experiences go towards. What's the Hinduism? Okay, that thought process. So that it correlates with that. What you see, what you're taught. Okay, another one, vegetative state. The person's alive, but we don't know what they can detect or
So
hear.
it's kind of like your first two, that they're
Awake
not even
and
hardly
awake.
awake,
They're
but
awake
they're awake if they're conscious, but are they not processing, so they're neither confused nor aware?
That's right. There's this what we call vegetative state.
Are you talking flatline EEG?
Can be. That's pretty serious. So I'm talking people that we keep alive for many, many years. They're this constant vegetative state. It's just a different. Then I already talked about diabetic coma. They're unconscious because of the blood sugar issue and this ketoacidosis, diabetic ketoacidosis. That's what he was in, but caused a different state. If the blood sugar's too low, they can go into either too high or too low from diabetes, but it's a different conscious state. Alcohol. You can get a person, I am telling you, you get your blood alcohol high enough, they're out. And they can be definitely confused, going back up to awake and confused. Alcohol can do that. I don't know where I'm at, whatever. Or you can get the blood alcohol so high that they are unconscious from an alcohol standpoint. You can do it with stroke coma. Patients with stroke, that's a big time hit to the brain, either hemorrhagic or embolic, where there's the bleed into the brain, or you put a thrombus into the brain. The thrombus we're actually doing a lot better with, like in Kennesaw or Erlanger. Dr. Devlin, who's the head of the department over there, they do what's called a mercy procedure. The patient comes in with this big embolic stroke, and he'll take his smartphone, and his phrase is, say this, today is a sunny day. So they'll take him up to their lab. It's a big, huge room with all these screens, and on the table they go in, and the invasive radiologist goes in and literally pulls the clot out of the brain.
Wow.
And now they can talk. Today is a sunny day.
Wow.
Literally turn that around from where they were to, they're correcting the raw. The evil.
The evil, the Hebrew word reshain.
Rashain or whatever. They're changing the dynamics.
Right.
Okay? They're changing this, the what is causing to destroy, to spoil, to make good for nothing. Okay? Then you have patients with traumatic brain injury. They get hit on the head, they fall or whatever. They're dazed, or you have a football player, bam! Now we call that a concussion, right? It's a concussion, it's a higher level. There was enough energy that went into the brain that now he's on the ground, not moving. That was a concussion. Well, that's causing damage to the brain, and over time, you keep doing that, and that's why they're now saying, okay, you can't play anymore, or now later these football players are having suicide of the ongoing traumatic brain injury. Well, I'm just looking at the conscious state where now he's unconscious, then he wakes up and he's dazed. Well, he's awake and not really aware. So that's a different type of states of consciousness, this concussion, traumatic brain injury. More interesting, here's one that's of interest to you. Both in Matthew 10, verse 19 through 20, and Mark 13, 11, it says, don't worry about what you are to speak and when you get, because the Holy Spirit will speak through you. You are now the conduit of these words. Really? That's the Matthew 10, 19 to 20, and Mark 13, 11. You are not speaking. The Holy Spirit is speaking through you. That's a different state of consciousness. Your mouth is moving.
Have you ever seen
I would
that?
agree with that. We spoke of this last night. I
So,
would agree with that.
so that's a different state of consciousness. Another one is hypnosis. Have you ever watched hypnosis?
Yep.
That's a hypnotic state.
They're not conscious, they're acting it. Maybe.
I don't know. I believe those are not, I've seen people, I watched hypnosis actually in process and watched them. That is a state of, that's an altered state of consciousness, that hypnotic state. I am telling you, and it's, I don't know what to make of, I get a little worried about it. I'm not real big on it, but I've seen enough of it. But you can get a sleep paralysis, hypnotic, and do all kinds of stuff. One other one that's of interesting to me is the meditative state. Deepak Chopra, I don't know if you know who he is. Deepak Chopra and his brother, they were both in Harvard, Boston University. Deepak was a cardiologist. And he goes into a lot of this Eastern religious stuff, and he's really into the meditation.
It's into the Ayurveda.
And recently I actually saw him on television where they were doing what's called functional MRI, live imaging of his brain and seeing it in action.
Of Deepak while he was thinking.
While he was doing it,
meditating.
sitting there, having that, and you watch the image and you can see what they're doing is looking at the chemical reaction or oxygen uptake. And you see, okay, the brain's functioning, and then when he would go into his meditative state, it would turn black.
Everything stopped.
Everything stopped except one little dot. I go, whoa, that's wild.
Wow.
Yeah, Deepak Chopra. Watched him right on television. I go, oh, that's pretty cool. So there is a meditative state of consciousness. That's a different state of
real
consciousness. Yes, I can see it happening in real time. I mean, whatever the brain is doing, it's changing.
And
he's affecting
overtly, proactively controlling that,
That's
doing
right.
it, going there
Yes,
on purpose.
that's right.
Shutting down various systems, leaving
Yeah.
this one open.
Yeah, in a meditative state of consciousness. Chemicals, obviously, you were mentioning different substances give you a high, whether it be LSD,
Smelling paint or...
well, yes, all the drugs out there that screw around with your chemical state. Here's another one that's interesting.
He knows.
Is the schizophrenic. Have you remember the movie Sybil? And each one had a different voice and a different presentation.
And didn't like the other one, but knew about the other one on some occasions.
That's different states of consciousness. Their brain is this, and now it's this person, and now it's this person. That's different states of consciousness. You follow me?
Oh, yeah.
Here's multiple.
Like
schizophrenia.
compartmentalized personality.
That's it. And then I've already talked about the dimethyltryptamine. That one is, that's probably one of the
That's
most.
one that comes from the
Ayahuasca plant.
yeah.
Yes, down in South America, and where you can pick the DMT art and DMT, all that stuff I showed you. Okay, and another one that's kind of an interesting is demon possessed.
Like the guy Legion in the scripture.
That's right. That's a state of consciousness. But out of his voice was saying, leave us alone. You, Jesus,
Right.
be the Son of God. We don't get out.
The demon consciousness.
The demon consciousness.
The body's not conscious, but the demon. Or maybe.
Yeah. Well, that's I don't know what to call it. It's a state of consciousness of some type.
And there's a duality there because are you looking at it as identifying the consciousness of demon, or are you looking at it from the perspective of what was the state of consciousness of the person such that the demon was able to infuse itself?
Well, that's the thing. The demon's possessed because once the demons were released from his body into those pigs that went into now the guy's standing there, calm, rational, back to awake and aware, thanking him, okay?
Did he remember being possessed?
I don't know, it doesn't say.
Right.
The Bible doesn't say anything about it. But the ones that, you know, that they say the kid that was thrashing around and they tried to help him and we couldn't do it and he's going into the fire. Okay. There's something in there, whether the kid was had seizure disorder, I don't know.
Some of it sounds like
possibility.
autism that I've seen.
Could have been that too.
Just like, Mike, you had a question you wanted to toss in?
Yeah, I've heard this. I don't know if it's true. I'm sure you would probably know that during the process of sleep, doesn't your body secrete DMT from your brain?
I have heard that.
Is that true or not?
I think there is some truth to that. I just don't know how much.
Okay.
But nothing to the effect that when you actually ingest it, either you can either take it by mouth or you can do inhale it. But I would not advise you to do it. I actually talked to someone that has done it, and he says he'll never do it again. It was a student nurse. He had done it 3 times, and you can get some pretty vivid, very vivid imagery on that.
I talked to somebody that stopped by. She had gone down to there. I'd never heard of it before, but she did that. And first your body just pours out, and then having been kind of purged itself of other things, she said she saw, I think she said she saw Jesus and Buddha and whatever else, but it was beyond.
Anyway, that's got me to my 18 current.
Oh, that was
states of
the last
consciousness.
one. That was your 18.
Yeah, demon possession was number 18, and I can still go on try to get to 22.
Yeah. So the reason why we're recording this just is so that I propose that the alphabet, the Hebrew alphabet, the 22 letters, is a map, is a structured, you might say, something which could be analyzed, determined, of human psychology. And we should probably shut this off, but that everything that you find probably can be mapped to it and organized according to it. The somic, the organized structure of the noon consciousness, and so he was just sitting here off the top of his head coming up with saying, hey look, there's 18, and I'll bet you could probably find 22, but that's just playing around with it.
Yeah, that's where I'm at now. So.
Thank you very much.
You're welcome. But